Welcome, everybody, to today's episode of Delta Oaks Ranch Podcast. We're excited to have a special guest with us, someone who has dedicated his career to serving seniors and helping them navigate the benefits available through Medicare and a lot of other HMOs. Joining us today is Hugo Santana, owner and manager and administrator / everything with A&A Financial Services. Since 2019, Hugo has been working closely with seniors, ensuring they receive the extra benefits they're entitled to. Medicaid, dental, vision, hearing, prescription, medications, doctor visits, and transportation. Thank you for joining us, Hugo. Thank you very much. I'm glad you're here today, and so we can talk. There's a bunch of things we've been talking offline about, but maybe we'll get into those a little bit later on. But tell us a little bit about yourself and A&A.
Yeah, thank you for having me here. Thank you. It's an honor to be here, and I love to be here. So A&A, I started with A&A 2019 and went at really hard on that. So I help out seniors with the Medicare questions, the premiums, the cost sharings, the medications, hospital bills, the dentals. We provide the adequate insurance for the adequate patient on that. So that's what we do on a day-to-day basis. Every time I sit down with the client, we go from head to toe assessment and make sure that the insurance is the adequate one for that particular client, because every client is different.
Right.
I can't put all the clients in the same exact insurance plan because it's different needs, different wants, and they're different locations, so that's exactly what I do and help out a lot.
Yeah, I can imagine that's a big challenge yourself. So explain for those out there that don't understand. So they call A&A, right? Mm-hmm. And so I know everybody's needs are different. Mm-hmm. How do you make a judgment, or what do you recommend? What information do you need? Because I've seen some people, I deal with elderly for different aspects, mm-hmm. for two other companies that are sponsoring our podcast. Mm-hmm. And some need dental more than they need vision, et cetera. Tell us about that.
So as soon as they call A&A, first thing is set up an appointment, talk to them, find out what their needs are. Head to toe assessment. I have a list of questions that I go through. First of all, do they have Part B? Are they already in an insurance plan? Are the doctors in the network? Are the doctors not in the network? And those are the questions that we always ask. And then there's also another question. Do they have Medicaid? Do they have a provider services? Do they have home health? Do they have different aspects of it? Do they have hospice? Can hospice and HMOs work together? Yes. But there's different ways of working together. So really, I could ask them several questions and I find out what they need right off the bat. But the main thing before I make a final and a judgment, I like to do face-to-face encounters. I travel from Brownsville.
So that's better.
Yes. I travel from Brownsville all the way to Laredo. I go all the way to Heavenville, Falfurrias, Corpus, all those areas. I have clients in Corpus. I have clients from Corpus down. And I travel and I help them on a face-to-face basis because I do spend my hour and a half with them, explaining to them their benefits and explain to them what they need. And again, they might need a $4,000 dental and the plan that they have is $3,000. Okay. So how are we going to...
So you're going to help them figure all that out.
Yes. It's a sit down and figure all that out.
Yeah. So you basically do like a interview and see what their needs are, and then you do your recommendations.
Exactly. Because there's no way I can do something within just by a phone call and just sit down and, I need insurance. It's like, this is not a car insurance. This is not house insurance.
You're dealing with people.
You're dealing with people's lives. This is really sit down and understanding their needs and talking to them. Again, we're talking to people age 65 and older. Some are educated, some have gone to a lower education part. I mean, maybe a GD, less than high school education. I mean,
right.
So, and it's not their fault on that part. I mean, it's
kind of like, I guess, not one size fits all. It's very unique. So what would be the key? Like if I was my dad or my grandpa or my grandma, what's the very first thing, if I understand this correctly, educate us. So once we're 65, we're eligible, or how does this start? I mean, explain that aspect of it.
So once you're 65, there's a certain criteria that are needed to become Medicare eligible. First of all, is the 40 credit hours. You've got to work the 10 quarters.
Okay.
I mean, not everybody talks about the 10 quarters, but the 10 quarters has to be worked on. So that's the 40 credit every quarter. The 10 years, every quarter out of each year is considered 4 credits. So you have to have the 40 credit hours on that.
Do you help them figure that out? Or like say, to me, I'm not the regular person, unless you're really in the field, you can figure this out. Is there something, perhaps somebody can call you?
Oh, yeah.
And you help them figure that out as well?
We can help them figure it out. And the thing is here is, don't wait to become 65 to figure it out, because this has to be done prior to the age of 65.
Oh, that makes a lot of sense.
So from 18 all the way to 65, you have to work the 40 credit hours, which is about 10 years,
right?
To 10 years of constantly working, either W-2, doing your income tax returns, all that. But there's some clients out there that I see a problem with teachers.
Yeah,
Teacher retirement does not pay into Medicare. So they do not get eligibility for the 40 credit hours.
And that's a big deal here in the Valley, because the education system, it's in every town, right?
Exactly.
So many teachers.
TRS is a different type of insurance that school employees receive, and sometimes some of those don't pay Medicare, don't pay the benefit for Medicare. They don't take away the little check, the 62.62, I think.
So what are teachers doing then? How are they making sure that they're covered?
Well, that's where we have to come in and educate them, because sometimes they don't know.
Yeah.
And they just keep on working because all they know is teaching.
Yeah.
And all they're certified is to teach. And that's what they love to do. And don't get me wrong, we need teachers, but that's what they love to do. But it's good to work on a side hustle for the teachers to create the 40 credit hours.
Right.
On those 3 months off, some teachers have worked. Some teachers have done part-time. Some teachers have done different stuff after 5 o'clock to create those 40 credit hours.
So going back to grandpa and grandma, right?
Yeah.
They need services. They need to get insured. Where can they find you? Do we have, Roland, something we can put up there and show the, or we can maybe work on it later?
Yes.
So you want to tell us about your address or phone number, how to find you?
Yes. My phone number is 956-516-3630. And I'm located in McAllen.
There we go.
I'm located in McAllen, Texas. I do in-home visits. You can meet me at the office. I have an office. I have a sub office in Harlingen, have a sub office in McAllen, and then I'm looking to get a sub office in San Juan also.
Awesome.
Great. And then I do have a sub office in Laredo that I can work with on that part. So, but my specialty and what I like to give to my clients is going to their homes and making them feel at ease and making them sure that we take care of everything, because the medicines are at home. The doctor's visits are at home. Sometimes some of my patients have a little calendar, as in I got to go to this one, or I got to go to therapy, I got to go here, and I got to go there. Sometimes they feel more at ease at home than they give me more information. And that's how I make a better judgment on their insurance.
Yes, and that makes a lot of sense. And subculturally here in the Rio Grande Valley, we were just talking about this a couple of minutes ago, right?
Yes.
It's very different, The Delta area is different from the McAllen.
Exactly.
McAllen from Rio Grande City to Brownsville, Hidalgo, you name it. It's all very different. But we're all the same, though. We might be slightly different, but we're all the same. We all have these needs for our grandparents, our parents soon. So you want us to start looking into it in our 40s to see how many credit hours we got, or what do you suggest on that?
It'd be in the 40s, 30s. Make sure that we just get those 40 credit hours to qualify for Medicare. Okay, and Medicare, as soon as you turn 65, sometimes they'll send you a card 3 months before.
Okay.
4 months before, and they'll tell you if that doesn't happen and you know that you're turning 65, and you work the 40 credit hours, it's a good time to call Social Security and find out, I'm turning 65, I haven't received anything.
Yes.
Because we're going to need to get you into some type of plan on that part. So,
Yeah, my opinion on that, I've encountered it with Concord, I've encountered it with Good Shepherd, is everybody's paid into the system. They're in hence it's called an entitlement for the most part. There's some exceptions sometimes that people that qualify, they didn't pay into the system. But I want to say a highest percentage, over 90%, maybe 95%, we all worked. You're earning those credits.
Yes.
So capitalize on this. Make sure that if you worked, you're getting the benefit back. And, look into it, see what you qualify, how they can help you. What do you need? Do you need more doctor visits? They'll call you and ask you, and you'll make that assessment.
Yes.
Right? And your number was up there.
Yes, 596-3630. You can call me at any time. And I have staff there getting the appointments, answering phone calls. We are open from 9 to 5 in the office, but our phone call, we have an on-call system also that goes from 9 o'clock in the morning to 8 o'clock at night. So we do have after-hours calls that will be answered.
Oh, that's awesome.
Somebody will attend to them.
Yeah, because if somebody's working after 5 o'clock, all of us, 9 to 5, we're busy. And then we'll remember, hey, I need to find out how I'm going to help out my mom or my dad or my grandparents, right? So we need to make that.
Yeah, and it won't be an answering service. It would be a live person answer the phone calls, so they can direct me and give me information as what I need to do, either that afternoon or that next morning, or somebody will get that phone call going.
Great, that's awesome.
So that's what we have.
So right now, I think we'll take the time. It's been a couple, 5-10 minutes that we've been talking. We're going to give away our first giveaway. For everybody, you need to start getting ready for that big game, the Super Bowl. So we're going to give away our first prize for those that have joined us and liked us on Facebook. Our media director, Roland, here in a minute, he's going to spin it, and we're going to see who's going to be our first winner of our first prize from the Delta Oaks Ranch podcast. And the winner is Kathy Carlson. I hope I'm pronouncing your last name correctly, Kathy. Thank you so much for joining us and liking us on our Facebook and join on our YouTube channel as well. And thank you for your for participating with us. So that is our first winner of the day, and I believe the first prize will be the Igloo thermos, right? Correct, Roland? That'll be the first prize. The second one would be the ice chest. We got a certain order here, but that be your first step, so you can start getting ready for the big game.
Exactly.
It's, I believe, on Sunday, the 9th, right?
The 9th. I think it starts at 5:30, doesn't it? Somewhere around there, 5:30.
5:30. Okay. Yeah. So, and I want to take this moment to thank one of our sponsors, Good Shepherd Primary Healthcare, providing provider services, home health. We care for you like our patients are our family. Call us today, 956-262-7445. Thank you, Good Shepherd, for your helping us out and sponsoring us to be here today, here at the Delta Oaks Ranch. So you were telling me, Hugo, that you're originally from Donna. Tell me now, let's talk a little bit about you. Who is Hugo Santana, the owner of A&A?
Okay.
Coming from Donna, Texas.
Donna, Texas.
Tell us.
From Donna, Texas, yes. I graduated in 1993 from Donna, Texas. I've been there all my life. My parents owned the flower shop, Santana's Flower Shop in Donna.
Okay.
They were in the business for about 45 years.
Wow.
Actually, my mom just shut down COVID. Right after COVID, after the COVID, it was like, she's like, you know what, this is it. Good. But we've been in business for that long. It was a good ride. Everything I've learned, everything I know how to treat people, it's because of my parents instilled those ethics on me. And that's something that I'm going to take forever.
Right.
Because it's just was very, very good.
Yeah.
We might have, at that time when we were young kids, we probably thought, Mom, I can't go. No, you got to come to Valentine's. We got to work on Valentine's Day. And you got to skip school.
But that builds character.
Exactly. But again, we don't see it until after the fact.
Yes, that's
and right now, all those days, now I see it as in, you know what? it wasn't wasted time. So at that time it was like, Mom, my friends are going here, and it's like, no, you got to stay here. You got to help me, But that created character on us, and that's what helped us a lot.
It's benefits. It's paying you dividends nowadays.
Exactly. Yeah.
No, I get it.
That. So Donna is my hometown, and then in 2005, got married to my beautiful wife Hugo Santana, and we moved to McAllen, and ever since then. But my roots are still in Donna. My parents are still in Donna. They're still alive, and my brother in Donna. All my sisters are in Donna. So we're still.
So you learned a lot of your business skills, how to deal with people working for your parents at the flower shop.
Yes.
Okay.
And that really showed me how to treat people with respect, treat people how to what they're looking for. Because of course I learned from the best.
Right.
My parents. My parents were the ones that always treating people with respect and knowing how to treat people, how to deal with situations, and that. So since I think I was 6 years old, we were quinceañeras, dropping up, picking up,
weddings,
all that, funerals, everything.
Every flower occasion.
Even the ones that they would get in trouble the weekend and Monday morning, they would come. I know those,
Right.
Those are the ones that I would love. It's like, oh, okay, they would come in. I'm in trouble. Okay, well,
but that hardly ever happens.
Yeah,
right.
Not being sarcastic. No,
maybe it was probably your number one seller, right?
It was
the makeup flowers.
Yeah,
and Valentine's Day is right around the corner too.
Exactly.
So everybody, don't forget, you need to get ready.
No, don't forget. Don't forget.
Ahead of time.
Yeah, as of me right now, I already took care of mine. I mean,
there you go.
It's like, you know what? Take care of it. My mom already closed. My sisters try to do it once in a while, but it's not always going. But yeah, so it's like I told myself, I don't want to be one of those last persons going into a flower shop and trying to buy something. It's like, but Valentine's around the corner.
Yeah.
Next week, next Friday.
Yeah. Next week. Yep. On the 14th, I believe that's a Thursday.
Yes, it is. So
yeah, right around the corner. So yeah, I need to start getting ready myself.
Yeah, you need to.
I don't want to get in trouble.
You get in trouble, and you get in trouble. It's gonna cost you one of the two. Those are the favorite ones for mine. It's like, you know what? You're the last minute. You're at 5 o'clock on Valentine's Day. It's like, really? You're like, we've been at it since last night at 10 o'clock at night, and we haven't slept. So it's like, and then you're here wanting us to like.
Well, you love to travel as well.
Yes, I do.
So have you ever done one for Valentine's trip?
I had it because of the flower shop, really.
Oh, that's
we really, everything was around the flower shop. Even though I was married with my wife, I would still help out my mom on that. It was like it was a known. It was not an ask. It was like, you know what? It's February the 14th. I'll be there, Mom. I mean, count me in. I'll be there. So don't make plans,
Do you send flowers to your mom too on Valentine's Day?
My dad sends flowers to my mom, but ever since, I never thought about it. Now that it was so easy for me, just, Mom, you already worked for flowers,
He's got it, right?
He's got it and everything else. But,
I send some to my mom because, my parents have been divorced since forever. So I would always take it upon myself. I'd send her some flowers as well. But what I was wondering as well, I don't know if you can look this up, Roland, is Valentine's Day just an American deal? And in Mexico, is it worldwide? I wonder about that.
I think it's
who else recognizes it, right?
Well, because the flowers come from Ecuador.
Okay.
The flowers come from overseas, Mexico. They come from different countries. Not all the flowers are from here.
Right.
So, I mean, I'm pretty sure they celebrate it or they know.
Yeah, but I don't know about the holiday, but I don't know if they recognize Valentine. I don't know. I just thought about it, right? I wonder if the whole world, or is it just kind of here nationally or in our region and in our continent, I should say. I'm a big fan of flowers, by the way. One of the things, our ranch, we would every year annually, we'd plant cosmos and zinnias.
Mm-hmm.
But unfortunately, because of the drought, we didn't do it last year.
Okay.
And I couldn't do it this year because this is the planting season. Right before spring, you got to plant them. And we have pictures up for those that want to look us up on Facebook for the ranch. We would plant about 1/4 of an acre. we'd have yellow, white, what we'd call the polar bears and the sunflowers and just beautiful flowers. I'm a big fan of flowers. And
That's good.
And we'd have flowers pretty much all the summer. But that's another topic, another podcast, another guest that we're going to have. Is the situation that a lot of people are not aware of, that we are still under a big drought.
Exactly.
And it's becoming a big deal. So yeah, but anyway, about flowers, I love flowers. That's
Hey, talking about drought on the insurances part. There is SEPs, which is special enrollment periods, because of the drought. So
really,
so some people out there, some clients out there are probably thinking, "Oh, I can't change because we just closed out the season. We just closed out." But there is special enrollment periods. Not talking about drought. So there is some type of election that you can do. You can probably do a change of plan or consider a better plan, whichever one they like to do. But that's something that we need to sit down and talk to about the Medicare Advantage plans and see what we can do for them.
Okay. So for the regular person that doesn't know this, you want to clarify, make it easy. So we don't wait because there's special enrollment periods. Well, when is the enrollment period? So everybody can start looking at
the annual enrollment period. It's October the 15th through December the 7th.
Okay.
That's when you see all the commercials on TV. Joe Namath, you see the Humanas, you see all the superstars. So you see all the superstars coming out that you have to enroll. You have to enroll. Okay, it's over December the 7th. Okay, and now January the 1st to January through March, there's considered to be another an oops type of a special enrollment period. And then there's also droughts, because of the droughts, because of the freezes, sometimes because of the hurricanes.
Exceptions.
There's a lot of exceptions on that part. So it's not always like, well, I get a lot of clients, can I move? Can I look into moving?
Yeah.
It's a head to toe assessment. And we need to look at all that again also so we can...
So that's another option that may, during the open enrollment...
Exactly.
People can change.
Exactly.
Okay, that's something I didn't know.
Something throughout the whole year, there is certain special enrollment periods that we can look into.
So what does somebody do if they miss even those special occasions when there's exceptions to enroll? They have to wait a whole year?
Yes. If there's no special enrollment periods, they have to wait the whole year until October the 15th to December the 7th. That's when the enrollment. Yeah. It's similar to employer coverage or employment enrollment when you go work at a location, and it's like it's only a certain time that you can enroll. You get hired and you can enroll, but you can't, after that, you can't make any changes until...
Well, I would think it would be important for the younger generation, and I'm not saying like super young, maybe around our age, I'm 53. If I already know my parents are not quite 65 or maybe even younger, right, in the 40s, because that generation, more than likely, they're not on watching TV or paying attention. So we need to be sure, right? Lock in those dates, try to memorize them. And help out your parents and your grandparents if they need to get enrolled.
Exactly.
Or to transfer, like you said, because maybe whatever plan they have, it's not covering what they need.
Yes.
Right? I know there's particular plans that favor like hearing aids.
Exactly.
There's other plans that favor vision care. There's other plans that, that just different fields. And I know you're the expert on that one.
Yeah. So there's a whole bunch of them, the plans, but I mean, there is benefits out there.
Yeah.
And it'd be very, very good for a client, anybody. I mean, even if they're not 65 yet.
Yes.
To make an appointment with me. That way there is a plan already for your loved one or you yourself, that, oh, you know what, this is what I'm going into.
Yes.
Because sometimes it's like, okay, what do I do? Like who do I call? And it's like you get angsty and you start doing judgments that are not very, very good judgments on that part, because it's like you got antsy. You just went out of just go at it because, oh my God, I got a card, or I got this, or I need to do this, or I need, it's best to sit down with any agent. It could be me or any. There's 1,800 agents here in the Valley.
Really, 1,800?
Yes.
Wow.
So it's a lot. You can sit down with any of them. We're all licensed and we're all certified to sell these products, and we all go through the same course. It's not going to be a different book for me or a different book for the other agent that's on the street.
You know what? Well, I have a very real important question for you that I've encountered for the other company, Concord Hospice Care, or even for Good Shepherd. And it's kind of like the elephant in the room that sometimes they don't want to talk about. And this is why I'm mentioning it. They're afraid they're going to lose their house. And if it's a Medicare product like hospice care and so forth, I know that doesn't affect them.
No.
Now, what can you tell us for your products, the MCOs for Medicaid? How does that work?
Okay, so any of my products don't have to do anything with Medicaid. It's all with Medicare. So in my products, there's nothing to do lose a home or anything like that. Where it comes down to the home, which is called the MERP law.
Yes.
And that's through Medicaid.
Okay.
That's a Medicaid question that is asked during the state will ask during the enrollment process.
Right.
There is options to supersede that. There is the Lady Bird deed that's out there. There's considered to be a transfer of death deed that's out there. And there's also those are the only two options, or because those do not get probated by the state. Those two programs do not get probated by the state of Texas.
So that's important to call and find out and get educated. So don't worry. There's workarounds, right? So, and educate everybody. You're not going to lose that house. There's ways you can get these services, and you're not going to lose your mom or your dad's house.
Exactly.
And I get it because they've worked all their life for those assets to build that house, to pay that lot. So, and that's something I would always encounter them and explain to them. You don't have to worry about, it's not going to take those rights away.
And then we also work with the area and aging programs here in Wesco office, and I believe in the Harlingen office. They do that for free.
Okay.
So they will help you and guide you with the TOD or the labor deed for free, and they will be able to help you. They have an attorney on call, so-called, and the attorney reviews all the documents, and then the staff there will execute the notary that's needed for those particular products, and then you just file them with the court.
Awesome. So that's good to know.
So something like that, the home's being lost, or I have my mom's house. I don't want to lose it. I don't want to get the benefits. So yes, it is that the law is there. Let's not. We're not going to shy away from that law. The law is there, but how can we supersede that law?
So there's ways. And for those that still don't understand, there is a law that if they take particular benefits from the federal government or the state government, they sign their rights away for the home. And that concerns everybody. So I want to rest assured and everybody make it understand. Call us, we'll explain those benefits. We can explain those to you, and you don't have to worry about it. There's ways to work around it and protect your parents or grandparents' assets, their home, their land, whatever they might have, right, to qualify. So I think it's time to do the second spin. Rolling, Mr. Wonderful. And you know what we should do right before we do that? Let's have some applause for the first winner. First winner, right? Or first winner of the, all right. Winner. All right. So let's do our second spin for our next winner. Who's it going to be? And it is Lisbeth VLZ. Maybe that stands for Valdez, maybe. If you're out there, Elizabeth, you're the second winner for our second prize, which is the ice chest. Let's see that picture of the ice chest. To hear that applause one more time, Roland. All right. All right. So there's a beautiful red. So there's no way you can lose it, right? You're going to see red pretty noticeable. And it's an awesome brand, Igloo. You can type along, put your stuff in there. You don't have to carry it. Just pull it with you. And again, I'll take the time to thank one of our sponsors, Concord Hospice Care. We are from the Rio Grande Valley and so is the San Antonio area. More than care, It's compassion. Call us today at 956-532-7983. Look us up, and there'll be a link on the bottom there. Something I would like to share about the hospice care, Concord. I like to say this, Hugo, and I think you might be able to relate to, is our parents used to take care of us, right?
Exactly.
And what I say is, it's our turn. It's our turn,
Exactly.
We got to take care of them. En buen español, ahora los toca a nosotros, right?
Exactamente.
Yeah, we got to take care of them. So that's a little slow.
And again, that's exactly what comes down. My parents, the way I take care of my parents is take care of my clients.
Yeah.
And I go, like from medicines to doctors to reviews to, hey, what this is going on. I'm having trouble with this. I have clients that call me, 10 times. I'll go visit them 10 times. It's like, hey.
Exactly, because all those clients, that's somebody's parents, right, Hugo?
Exactly. So I treat them as parents. I treat them as my mom and dad. And the way I like to treat my mom and dad is the way I like to treat my clients on that part. So it's really
awesome.
And I believe in every aspect in Good Shepherd and Concord. That's our goal, helping. And exactly what you said, they took care of us for so long. Now it's our time to take care of them.
Exactly.
And we have that compassion, we have that love to do that, and we see the outcome on it. Because that's really what we're here for, to help them. Help them out, because of course they need our help now.
They certainly do. And I think culturally here in our area, that's different from the San Antonio, I don't know if you're going to agree with, is that most of the time here in the Rio Grande Valley, we take care of our parents and grandparents at home.
Yep.
And that's why I like to say it's our turn. We got to take care of them. San Antonio, they love their parents, of course. But I think it's slightly different, the culture. They put them in nursing homes and so forth, just slightly different, but nonetheless, it's their turn.
Yes.
They're taking care of them, right?
Hospice homes out there in San Antonio.
Exactly.
Those little homes that they rent the offices or the rooms, and it's still hospice.
Yes.
They divide the house in 4 or 5.
And that's some of the new products that both of the companies are going to start promoting is private pay. And there'll be different options, because most of the time we work for all these assets.
Exactly.
And people, you have health insurance, you have life insurance after you pass away, but what they don't have is insurance for hospice care.
Exactly.
Right? And that's one of the products that we're promoting is private pay. Because what happens, and I've seen this happen, Hugo, is they'll start selling the assets to take care of mom and dad. So it's changing here in the Valley, where we take care of our parents at their home, but everybody's working.
Exactly.
Everybody's working. Somebody's got to take care of them. So they'll start selling their home or their car to take care of those extra bills. So we have an option for that. Instead of selling those things, you can start prepaying those items and be prepared.
Exactly.
But that's a topic for another day. But
we go into so many topics.
Yeah, it is. It really is. There's so much to talk. There's just not enough time. But we'll go ahead and do our last draw or spin on our prize. Our main prize is a barbecue grill. All right, so we can get ready for the big game. The big game, yeah. And here we go. And the winner is Sweet Honey Rose. Okay, Sweet Honey Rose. Like that name. Wow. Sweet Honey Rose. Interesting. Thank you for your support, Sweet Honey Rose. And you are the winner today for a barbecue grill.
And where are they going to pick this up?
Oh, yeah, I'm glad you asked.
I mean, it's just,
well, they can come to our office located here in Edcouch, Texas, the big city of Edcouch, Texas, here in the Delta area. And our address is 7981 Mile 17 North here in Edcouch. Call us or we can meet you somewhere and help you deliver it to you. I understand I work all day as well. Sometimes I don't have time. We'll help you. We'll get those gifts out to you. And I want to thank everybody today for participating. Hugo, thank you so much for being our guest and explaining all these benefits. They have a lot of questions. And for those of you that still have more questions, please call Hugo and we can put up his number up there. And I'm more than sure he'd be super happy to go up there, give you a phone call or give you a visit and answer all those questions. Make sure you have the right coverage today. So thank you so much, everybody. And that's it for today's podcast. Thank you very much.
Thank you.
Yes.